protect our kids. Now, we've talked about feeding them and we've talked about educating them, but let's talk a little bit about our health care, because if we don't have healthy kids to send to school, then they're not going to learn very well, are they? So next up, we have pediatrician Dr. Ray Brown. Speak into, they're having a hard time hearing you back, so speak very close.
Okay. Everybody hear me? Any of you folks know Andy Barr? Andy's not here today. Andy's going to vote to cut Medicaid for the 39,000 children in Fayette County by $880 billion over 10 years. That will be devastating. I think it will be criminal. Let me tell you a little bit of background on this story. This is an urgent call to action. Medicaid is a joint federal and state program, and it provides health care to basically three groups of people in Kentucky and across the country. It provides health care to children. In some states, up to 50% of children would get no health care if they did not have Medicaid support. To the disabled. And every disabled person does not get Medicaid. It's very difficult, even if you are disabled. And the working parents of children who are on Medicaid. These children, keep in mind, would not have any other health care. And what happens is that when children get sick, they don't have any support. Parents will not bring them to a doctor or emergency room. And because of that, children are injured. Think about what it's going to be like when they cut $880 billion out of Medicaid. In the Commonwealth of Kentucky, we have 1.5 million of our citizens, of which half are children who require Medicaid. And why is that? That is because we have a very low level of reimbursement for 40 hours of work in our country. So the minimum wage has been the same for more years than I can remember. And it's not at a level where people can survive and pay for health insurance and to put food on the table. It's simply not. So if we take Medicaid away, we're literally taking away a lifeline to families all over Kentucky. Now, the Republicans would have you believe that there's graft, that there is waste in the program. I worked in the Medicaid program in Arkansas for a time, and I can tell you that it is the most efficient healthcare system probably in the world. The marginal cost of providing health care is 1%. I want you to think about that. Think about the fact that when you have health insurance, and that health insurance is private health insurance, $15 goes to administrative costs and to pay folks that sit in offices before any goods and services are provided for children or for anyone. 15, so if you have United Healthcare, or you have Blue Cross Blue Shield, or you have Aetna, Cigna, any of those things, about $15 goes for nothing other than getting people to type on a typewriter. 1% of Medicaid funds go to administer the Medicaid program. Medicare is is a similar story. Medicare provides the same level of service, and people like it for less than 5%. They have looked at this 10 times in the last 20 years to try to find where the money was going. And I can tell you, having worked at the University of Kentucky and the University of Arkansas and hospitals in North Carolina, mostly with poor children, that the money is going to take care of children that have been injured. It's going to take care of children that have not been vaccinated. It's going to take care to make certain that children have nutrition programs. And do you think that Donald Trump, who is playing golf in Florida today, do you think he cares? No, he doesn't care. Do you think Andy Barr, who is not here today, do you think Andy Barr cares? $880 billion to take health care away from children. I can't stomach that. It is a crime, and we can't have it.
Thank you so much. All right, we've been talking